So my name's Dr. Tom Dawson. I'm a paediatrician with interest in allergy here at Midland Health. When you're looking at colds and allergies, usually the complication is between having allergic rhinitis, which is inflammation in the nose, and sometimes with a bit of cough with that as well, throat clearing, blocked nose, and sometimes some secretions or snot. For allergic rhinitis, the symptoms usually are a little bit more chronic. So coughs and colds generally go within a few days to a week, whereas the allergic rhinitis is usually there all the time. It's difficult to shake it, and they're always sniffing, always rubbing their noses, clear secretions rather than the yellow or green ones that you see with colds and infections. A big sort of 10 group of allergens, but the most common allergies that we see in clinic are milk, egg, wheat, soya, and peanut. There's two groups of tests that you can do. One is a skin prick test, and with that we would identify which allergens we wanted to test, and down the arm, usually on the forearm, we'd write down what we're testing against, drip some allergen solution against the identifier, and then prick through that with something a bit like a sharp pencil, just penetrates the top layer of the skin. We do something called a specific IgE, and that looks for the same antibody that you're looking for with the skin prick test, and that we take as a blood sample. And then there's another test called an allergens test that we sometimes use, which is a multi-component allergen test. And that looks at the individual proteins within each food. So sometimes, like peanut, there's 6 different allergens that may be relevant. I think now we have more evidence to introduce allergens early, particularly in children who have a high risk for allergy. And those children are those mostly with a good family history and some moderate to severe eczema. So those are the children I really want to see in clinic to make sure that they get allergens in early. So it's important that we get those foods in early. And the foods that I'm interested in are milk and egg, wheat and soya. It's just, as you point out, the seasons change, and so the allergens or aeroallergens that we're talking about here will change and become more dominant in different times of year. So early in the year, we're looking at sort of tree pollens, the early tree pollens, and then moving into sort of May, June time, when some of the late tree pollens like birch and some grass pollens, Timothy grass, will come into the fray. And then towards the end of summer, we'll be looking at some of the leaf molds that turn up. So Alternaria is around then, and Cladosporum. And then moving into the September, as the pollen tends to be going at that point, and then moving into the winter, you'll have the house dust mite, which is actually a perennial allergen. That means it's there all year round. It's just that people spend more time indoors in the winter, so they get more exposure. School is a big concern for a lot of my patients' families when they come in, especially when they're changing school or just starting school. The most important thing is communication between the school and parents, and making sure they have an allergy plan in place so that everyone at school knows they've got an allergy and knows where to find the treatment for them were they to have a reaction. And also, if they have a serious reaction, how to administer adrenaline if that's required. These reactions, in my experience, are actually quite infrequent in school. Most of the serious reactions I see are not in school, but it's important that you have that plan in place. And at school, I think it's really important that children with allergies aren't isolated and put into a separate table or made to eat on their own because of their allergy, because they need to learn to live with the allergens in the environment as they go forward. So if you do have any allergies or questions about allergy, or you think you need an appointment, you can book an appointment with me or allergy consultants online at Midland Health.